I'm Pamela Bailey, the manager of community programs at the Center for Community Health and Prevention. For the last 8 years, we have been training people in churches, in physician practices, and in other community centers to run their own diabetes prevention programs. The Diabetes Prevention Program is an evidence-based research program that has been shown to reduce the likelihood of developing diabetes by 58%. By losing a little bit of weight, bettering nutrition, and increasing physical activity, participants are able to greatly reduce their likelihood of developing diabetes and also live healthier lives. We've partnered with a number of churches, and one of them is New Bethel CME Church. So hopefully today you'll learn a little bit about some of the people who have gone through the program, people who have facilitated the program, and their stories.
Hi, my name is Patricia Rector-Holloman, Reverend Patricia Rector-Holloman. I am the facilitator here at the New Bethel CME Church, DPP. And what has impacted me the most about this program is just the lives that it has changed, not only among our parishioners, but also in the community. We have people who are off their high blood pressure medication and individuals losing weight and doing lifestyle changes. And it's just remarkable to see it 1 year later. And hopefully we'll continue to grow the program outside of the community. We're about saving lives. We're about getting rid of heart disease and high blood pressure and fighting diabetes so that people can lead lifestyle changes forever.
My name is Reverend Angela Richardson. This is like the second or third round for me. And I found it helpful in terms of having a community of people who are thinking the same way and supporting each other about eating better and exercising and all of that. And it's a camaraderie thing, but it's also a support to have other people. And we talk about the challenges we had during the week, and I can identify with some of them. And people also bring, though, the things that they did that were successful for them, and that helps a lot in terms of my own challenges.
My name is Arlene Wilson. I'm a member of New Bethel CME Church. I'm also a church historian, and I'm involved with the DPP, the Diabetes Prevention Program. I was very excited to see that come to our church, knowing how effective that's been in other settings, primarily clinical settings, but having done outreach for health and for employee of the American Diabetes Association, I know it's really important to have linkages with faith communities. It's been a successful partnership on health maintenance and health disease prevention. As a participant, it's been very helpful, and you can know the information, you can read the information, you can have books and pamphlets and all of that stuff, which I have, but there's something about the support of a group that is really key to helping you stay on course, and also knowing you can be weighed helps to keep you accountable, definitely. But it's also a nice way to learn and to support each other in the learning process. It doesn't feel as overwhelming when you see other people struggling with dietary changes, lifestyle changes, and so it encourages you in your struggle as well.
Hi, I am Regina James, and I am a devoted DPP facilitator and participant. It makes me even more mindful of the things I need to put in my mouth, how physically active I need to be. Actually, it has impacted me so much so that I consider myself a role model, and as doing such, I try to not only just talk the talk as a facilitator, but actually walk the walk. DPP has really made a massive awareness within the communities that I find myself in. A lot of people now are more aware of, again, what they eat, how they eat, when they eat, the activities that they're doing. Whereas before you would eat and watch television, now people are getting out and they're exercising, they're getting some fresh air. You hear a lot more conversations about what we should be eating, what we should be doing. And not only that, people are fellowshipping more with one another because they're concerned not just about their health, but the health of those around them. Families are coming back to the table, and that's a big thing in this fast-paced society that we live in. People are actually looking forward to seeing what's what's for dinner? If not, what's for breakfast? And that's great. That says a lot. And if it wasn't for the diabetes prevention program, so prevalent in Rochester, I don't think those conversations would be had. I don't think that families would be coming back together. They're more concerned about their families. They're more concerned about their loved ones. They're more concerned about their communities. People are lobbying for having more fruits and vegetables in their stores, whereas before it was like they just took what was given to them. But now people are being more active in what's going on, not only in their household, but in their neighborhoods, in their communities. And I thank you, DPP, for bringing the program to the communities, because it's definitely making a big, big impact.